السلام عليكم. لا تنسوا الإعجاب بالفيديو والاشتراك في القناة تشجيعا لنا لنستمر بنشر المزيد إن شاء الله.
So here's a question. Why is hypertension the primary driver of severe symptoms of COVID-19? In a recent survey of 5,700 patients, 88% of them had more than one illness, which is actually quite interesting. And the general mortality rate of being put on a ventilator is 88%. The statistics are not very good that you're going to actually survive. The more illnesses that you have, the more risk you are of being put on a ventilator. Here's my question. Why is the most common chronic underlying condition high blood pressure? If you look at one study, it's 69.1%, and another study, it's 53%. It's always at the top of the list of being the most common symptom of COVID-19. The next one would be obesity, that's 42%. And then we have diabetes, 32%. And then we have morbid obesity, which is a severe obese situation, 19%. And then 10% would be heart disease. But why is it the hypertension? There's something called an ACE2 receptor, okay? The ACE2 receptor is in the outside of your cell. It is the door or the portal where COVID-19 can go into the cell. Now, have you ever heard of something called ACE inhibitors? There's another one called angiotensin receptor blocker. These are types of medication that lower blood pressure. What they're finding is that when people are taking these ACE inhibitors, there is an increase of upregulation, okay, by 3 to 5 times. In other words, when you take a drug for a period of time, you develop resistance to it. And then what happens, it overcompensates and you start developing new receptors. Now, in no way am I telling you to come off your medication. Check with your doctor before coming off your medication because there is some conflicting data on this topic. The big point is that this receptor is the door for the virus. And what's interesting too is that the more you have high blood pressure, the more you have obesity, diabetes, and the more obesity you have, as well as cardiovascular disease, the more quantity of ACE2 receptors you're going to get. Now, I want to just switch gears for a second and talk about high blood pressure. 90% of all hypertension is essential hypertension. What does that mean? Essential means they don't know what causes it. However, if you search vitamin D deficiency with hypertension, you're going to find a ton of research and data that concludes that when you give a patient with hypertension vitamin D, their blood pressure goes down. Could it be that the real risk factor of having complications and side effects and being put on a ventilator is an actual vitamin D deficiency in the first place? Because if you're trying to evaluate something, you want to take all these pieces of the puzzle and see if they align. What does vitamin D do to the lungs? Well, number one, it has a potential to decrease inflammation in your lungs. Also, it has a lot to do with controlling the T regulatory cells, which are involved in suppressing the inflammation in the lungs in the cytokine storm. Then you have the other factor involving why certain viruses are more active in the winter or the fall or the early spring than the summer. Could it be just the vitamin D exposure that you're not getting to protect the immune system? Certain viruses have this very interesting strategy of blocking the vitamin D receptor inside your cells. What does that do? It's going to block your ability to absorb vitamin D. Why would they do that? Because vitamin D is one of the key nutrients in controlling your immune system. And if they can actually block that, now your susceptibility goes way down. The door opens up, they can get in and replicate. Anyway, I just wanted to tell you my theory, and please comment below on what you think about this topic.